right, now on to the Health Watch, where we discuss all of the topics that are trending in the medical world. And as always, we're joined by Dr. Syed Hussain of Trinity Health of New England. Good to see you again, sir.
Likewise.
Glad to have you here. A lot to talk about. First things first, this one sounds almost unbelievable. A new study showed that breast cancer in women between age 70 and 85 is often getting over-diagnosed, which means they're getting treated too much. I've heard some arguments that maybe we're over-screening and catching ones that don't necessarily need treatment. But is this study saying there are some cancers they find that might not need to be treated, at least right away?
Yeah, that's what the study suggests, Tim. So this is a study looking at over 50,000 women in the age group of 70 to 85. And keep in mind, our technology in terms of detecting cancer has become so much better over the years. So now we're able to detect lesions that are very, very small as the size of a pea.
Yeah.
So what this study basically says, some of these cancers, while it is cancer, may be very slow growing or dormant. And is this leading to overtreatment? Keep in mind, the diagnosis itself carries so much anguish to the individual who gets diagnosed, family members, and is there overtreatment in terms of radiation, chemo, surgery that's happening in this particular age group? Now, keep in mind, we discussed this topic of breast cancer screening a few months ago, Tim, and the USPSTF, that's the United States Preventive Services Task Force, released a draft recommendation earlier this year that said screening for women for breast cancer should probably start at an earlier age of 40, but does it really need to happen or take place after the age of 75? It's inconclusive. There's not enough evidence. So more studies and more research is needed whether we really are as aggressive in this age group.
It reminds me of prostate cancer. Once you get to a certain age up there, maybe it's a cancer you will die with, not from, because it grows so slowly.
That's right.
The weight loss drug ROKU has been reported to lower the risk of adverse cardiovascular events by 20%. Now, of course, we know Wegovy helps you lose weight. We know losing weight helps you avoid a lot of problems. But I guess this helps. This is drawing a more conclusive through line between the drug and the benefits?
So there's a study that the drug maker Novo Nordisk conducted. They have not released all the data yet. So I'm interested in reviewing all the data from the study. It does appear to show a 20% reduction in cardiovascular events such as heart attacks and strokes in those individuals who have underlying cardiovascular disease to begin with. But it doesn't comment on whether this is because of the mechanism of how the drug works, or is it solely because it reduces obesity, it causes weight reduction, which we know is an independent risk factor for some of these diseases. So I would love to see more data, Tim, before saying conclusively that this is because of XYZ reason.
I like that nuance there. While we're on that topic, something that's starting to make headlines, it was a big global study that is trying to maybe connect air pollution to a rise in antibiotic resistance. But connect and associated, these words might be carrying a lot of weight, doing a lot of work here. What are some of the sort of, I don't want to say red flags, but you just, I guess, caution.
Yeah, a little bit of caution. I think that's a good word to use so that folks are aware that this is an observational study. There's no cause and effect here. There's possibly a link or an association. This is a large observational study spanning 2 decades. From data from over 100 countries was collected. And there may be a link to higher air pollution with higher antibiotic resistance. Now, taken by themselves, these are huge problems that we have to confront anyways. But this study indicates there may be a link in terms of more particular matter that's associated with higher air pollution and antibiotic resistance.
Yes, and it's good to know that sometimes there is that uncertainty there, and that we're at fault of this as much as anybody with the news. We boil things down to a headline, and then you miss some of that nuance, some of that uncertainty that's just inherent in the scientific process. So it's important to point that out, and that's why we have you here for it. Doctor, thank you so much for joining us again, as we do every week. Granted, last week it was on Friday, but we usually do it here on Wednesdays.